Hello guys, how are you? Today I have this fancy case, and this is the wax up. The midline on the wax up is not correct, so I drew the midline in here, but doctor says to follow everything else precisely. So on the shade, the doctor said that the shade is going to be P62. It's characterized by a lot of translucency on the edge, and that's what it looks like. And it looks, the closest to it is something like a 1A2. This is the bridge. I'm gonna build it out of A1. Before I screw it in, I'm gonna apply some of my tissue underneath. I'm using tissue 24. So I don't like to use like this too, because nobody that I seen of has such a rich color in the gums. Just this. And then some, you can always shade the gum after you're done. But this to make it look like the patient's gums are inflamed or something. And this, of course, only anemic people have, which is not funny, but And so it's usually like this too, and a little bit of that sometimes. Depends on the shade. This very rarely, just to mimic where the roots of the teeth are. Okay, so right now I'm applying 24, just filling up the bulk, because nobody is gonna see your tissue underneath. So I think something like darker maybe would do good in there, but not too light, not too dark. Because I've seen a lot of cases, like online and everywhere else, where the tissue is like red. I don't know, maybe some people naturally do have that, but I haven't seen it myself. Alright, that's the same shade that I just showed you before. That's 24. It's not gonna be a lot of it, just a tad bit on the where the tissue is meeting, the artificial tissue is meeting the real tissue, and in between. It's a lower case, not the upper. Upper cases, of course, have like much more details and interesting stuff in there, but there's not too many lower cases videos online. I thought it would be nice to make one. Alright, also, this person's tissue is not very bulky. You can see it's like pretty smooth, doesn't really stick out much. So I'm gonna follow that and try to make my tissue also smooth without a lot of bulk. Okay, so now next one I'm gonna apply some of my shade 23. Alright, so I'm gonna do some more details after I build my teeth. First I'm gonna apply inside 44. That's Apicius, or the one that is corresponding to your shade. Okay, then some more on the occlusion. I'm gonna apply FD91. That's fluorescent dentin. That's what it looks like in the bite right now. I take it off the articulator because it is very hard for me to hold it next to the camera. But once in a while I'm gonna try it on. Okay, so now I'm applying this fluorescent dentin to the edge, If you don't have fluorescent dentin, then you can apply just opacious to the edge. Okay, so now I'm gonna apply my regular A1 dentin. By the way, guys, you see how it's starting to dry up a little bit, and I used to tell you that it's okay to drop like a drop of your build-up liquid on the bridge if it's drying up. But one of my subscribers, who is a very reputable source of information, very knowledgeable, told me that no, you should not do it by any means, because that's just how the porcelain is gonna trap some water in between the layer of porcelain and base layer, like opaque or zirconia or what have you. So then if you need to make it more wet, then only distilled water would work. So I went and I appropriated some distilled water, and I'm gonna put it in this box. And so when I need to wet my porcelain, I'm just gonna dip my brush into that and put a drop of that on porcelain. So you know, I'm sorry I was teaching you the wrong way, but I myself have a lot to learn still. I'm glad that now I know the right way. And we're also gonna check it out today, how it works. The bridge having or not having any cracks, you know, if it has bubbles and stuff like that. That's the first time that I'm trying that technique. And also I'm not gonna dry up my bridge completely on a tray. I'm gonna dry it to, you know, certain amount, and then I'm gonna put it in the oven, and I'm gonna make a very long program. So the first 10 minutes dry up on a low temperature, and then another on a higher temperature. And like, you know, if your oven has a pre-drying cycle, that is a good thing to consider. Just learned about it recently on Friday, I think. So today I'm gonna try it out. Hopefully it's gonna be my new favorite technique. But this is so cool, guys, you know, like we are almost 1,000 people on this channel, and I am very excited because, you know, it's such a channel. I thought there's not many dental techs and, you know, just the niche itself, but look at that. We're all here and all talk in the comments and discuss different techniques and share our experience, knowledge with each other, and I think it's great. So it's working out pretty well. Let's try it out. Very good. It looks good. Okay. So now I'm gonna do the cutback. My shade you've seen is such that it's a lot of translucency on the mesial and distal, and a little bit of opacity in the middle. Alright, so now the cutback is done, and CLF is this porcelain is very translucent. You know, people who are watching this channel for a while, it's like this. This is added to make this effect, like very clear edge. I'll do it with brush number 3. Then some in the middle. and then I'm gonna put the translucent Mamilone yellow TM4, this one. That is you know, to add a little bit of the dimension. It goes in between, so the yellow Mamilone goes in between of my 3 little fingers that I made, like this. Okay, so now after all that, I'm gonna take a little bit of this shade TM1. It's a very blue, but I think it would look nice in here too. So I'll apply a tiny bit on all the edges on mesial and distal side. That is not necessary. That's just what I decided to do. I like that shade. But one thing, you have to be very careful with it because it's so bright. You don't want to end up with literally a blue tooth. So now, in the very end, I will apply a thin layer of enamel number 58. It's not very translucent at all, so I'm gonna apply like a small amount of it, so to keep everything still translucent. I'm just gonna frame my crowns. And also I'm gonna make the line angle out of it like this. Okay, so this is what the porcelain looks like at this point. And you know, the tissue of course needs to be added. Let me see. So I'm gonna add this 26 in between, just like this. And I don't think that the lower teeth have this, that thing, I don't know what it's called, in the middle, you know, like the uppers have it right here. I don't know. Do you know if the lowers have that? I think they don't. Let me see. No. Okay, so mine don't. That means that most likely nobody has it like that. My battery is dying. I really hope that it will live long enough for me to finish this. Okay, and now I'm applying enamel 23. This one. Okay, and now I'm gonna do a little bit each tooth in here. Let me know if this is correct what I'm doing, or if it's not correct, then how would you do it, and what is the correct way. Okay guys, it looks to me like that's it and I'm done. And let's bake that thing and see how it comes out. And I will see you after bake. Okay? See ya. Let's see. So this is my shade. The shade is actually one of the best parts. That kinda did come out the way I wanted. Just a little of shading and it's gonna be there. But I don't like the tissue at all. And it cracked here and there and stuff like that. So I will first prolong my teeth and cover all the cracks like this. This is I mixed some of my apiaceous inside and regular Dentin. Okay, so now I'm gonna apply a mixture of this 23 and this 35 anemic shade. I call it that way because, you know, I myself am prone to anemia and my gums sometimes start to look like that, pale gums. But recently it's been all good. Okay, hopefully this time will come out better, and I will see you after bake. Okay guys, so that's what it looks like right now. I like it better now, definitely. Like, you know, sometimes they have those like dots in here, and I didn't know how to make them, but I just took this thing and on high speed did the little dots. But if anybody knows a better method, then let me know. Okay, let's glaze this. I have all these shades of Neo, and I have this structure enamel orchid that is for me to fix the little cracks. Okay, so let's do it here. So I think that the translucency came out pretty good, you know, like, but it's too light, mine. So I'm gonna take some of this orange, stains in between like that. Yeah, like, don't rush into shading your whole crown before you do your little details, because just the details might help your crowns look the way you want it to be. Almost. And then I'm gonna take my coral mummy one, and I'm gonna draw a little bit in here, and then I'm gonna do a little bit of my occlusion stain, and of course some on the occlusion itself. Okay, well, that's what the look is of right now. Stain a little bit with this salmon pink. I like that pink because it's like a warmer color. All the other pinks are like, you know, they're pretty cold. This one, yeah, I think that the people have tissue that's more of the warm color. I mean, mine is. And also, you know how people have those like blood capillaries in their gums. So of course it's better to do it if you have a full, you know, like longer gum. But because they need to match to the existing ones. But just for fun, we're gonna put him a couple of those. Okay, so that's his blood. I don't know if you can see it, but it's there. And yeah, for blood I used this garnet It didn't come out too bright.
I'll see you after glaze.
Okay guys, this is case after glaze. I think that the shade came out pretty good. Hold on. I don't know how to show it. There we go. So I think his shade is pretty good. Came out, you know, translucent like he wanted. And well, that's his tissue. There is I don't know if you can see his blood vessels. Came out alright, I think. And yeah, that's it for this case. I did not polish it, but because I don't do this part in our lab. And so yeah, let me know what you think about it, if you like it or not, how would you do it yourself. And thank you for watching. Subscribe. Thank you for everybody who subscribed, and I'll see you very soon. Bye bye.